This lecture is about Bayes' theorem. So far, we've been unable to definitively answer the question of how likely it is that a woman with a positive pregnancy test is pregnant, based only on the results of a diagnostic accuracy study. We will now look at Bayes' theorem as a way to solve this problem. Thomas Bayes was a philosopher, statistician, and clergyman who died in 1761 and whose most famous work was published 2 years later in 1763 and was called An Essay Towards Solving a Problem in the Doctrine of Chances. A simple way of stating Bayes' theorem as it relates to diagnostic tests is that if we know the likelihood of a condition initially, then we add some new information in the form of a test, we will get a new or updated probability of the condition. We call the initial chance of the diagnosis the pretest probability, and when we add new information in the form of a test, we get to the post-test probability. So if we want to know how likely it is that a woman with a positive pregnancy test is pregnant using Bayes' theorem, the first thing we need to know is the chance of pregnancy before the test, or the pretest probability. To do this, we would take a history and include factors such as age, previous pregnancies, any use of contraception, and timing of intercourse, etc. For example, a younger woman with a 2-year-old child who's been having regular unprotected intercourse is more likely to be pregnant than an older woman who has never been pregnant, despite never using contraception and having regular intercourse. In other fields, there are well-defined clinical decision rules for determining pretest probability. One of the most well-known being the Wells criteria for pulmonary embolus, which is calculated from a variety of clinical factors. Although there are no such rules for pregnancy, we would nonetheless go ahead and estimate the pretest probability from our clinical history. Now we have our pretest probability, the next thing to do is to add the information from the test. And to do this, we first go back to our trusted 2x2 table. The value we are looking for is called the likelihood ratio, and it's defined as sensitivity divided by 1 minus specificity, or by this equation. Note that this is the first value we have seen so far that has been calculated using all 4 values from the table. There are actually 2 likelihood ratios for each test. Likelihood ratio positive, when the test is positive, which is a value greater than 1, and the likelihood ratio negative for a negative test, which is a value less than 1. In this case, the likelihood ratio positive is 25. Remember, pretest probability combined with likelihood ratio gives post-test probability. Let's say we determine pretest probability for our patient to be 50%. Combined with the likelihood ratio of 25 gives a post-test probability of 96%. Don't worry about the maths behind this, we will come to that later. Just be aware that there is a way of combining pretest probabilities with likelihood ratios to give post-test probabilities. By comparison, if the pretest probability had been 25%, combined with the likelihood ratio, we would get a post-test probability of 89%. I've deliberately simplified the maths, because what you actually have to do is convert probability to odds and then back again, which is daunting and looks something like this. But don't worry, you don't need to know how to do this. Luckily, there are numerous online calculators and smartphone apps that can do the calculations for you. This example is from the University of Illinois. I filled in prevalence, which is the same as pretest probability, as 0.5, and the sensitivity and specificity, along with a sample size of 450. This is the output, showing the positive likelihood ratio of 25 and posterior or post-test probability of 96%. The negative likelihood ratio is 0.01, so if the test was negative, the post-test probability would be 1%. So that's the basis of Bayes' theorem in a nutshell. It's a way of combining all the information from the 2x2 table into a single figure, which when combined with the pretest probability gives the post-test probability of the diagnosis. Before going on, I'd like to explain the position of Bayes' theorem in clinical medicine. Based on what you've just learnt, you might expect to see doctors using smartphone apps on the wards to calculate the post-test probability of conditions of their patients. But in reality, you will rarely see that happening. Experienced doctors make accurate clinical decisions without recourse to the mathematics of Bayes' theorem, but they're using the same process in their mind, often in a subconscious way. When a doctor is given a new piece of information, they tend to add it to what they already know, to update their thinking about a probability, which is exactly what Bayes' theorem is. The reason for learning about Bayes' theorem is not necessarily so that you can make these calculations for each patient, although you're encouraged to try. It's so that you can understand how the brain of an experienced clinician is working to produce accurate answers from complex information.